and welcome back to the House of Homeo Ed. We've discussed acute case taking in detail in our previous videos. Today let's talk about some important things that we must elicit but tend to usually forget when we are taking a chronic case. Now when we talk of chronic cases, let's start off with talking about physical particulars. Now in our physical particular, LSMC is something that we must elicit. But in this we usually forget to talk about extension and radiation of any complaint, especially if the patient is complaining of pain. Okay. Next we usually tend to ignore or forget is the ODP. Okay. Onset, duration, progress. Make sure you're asking this to your patient. Concomitants may or may not be there in your patient, but make sure you're asking the right questions to elicit if there are any. Okay. When we come to patient as a person, the first thing that should come to our mind is the appearance of our patient. Now, when I say appearance, I just don't mean the fat, fair, flabby description. I also mean our tiny little observations about the patient, about their behavior, body language. Okay, so make sure you are taking that down as well in your appearance. Okay, in that patient as a person, the next thing we are supposed to elicit properly is a craving and aversion. Okay, now a craving and aversion is not something like a list of things your patient likes or doesn't like to eat. Okay, craving is something your patient loves to eat. Okay, which is their absolute favorite taste or absolute favorite thing to eat. And aversion is the absolute opposite. Okay, something that they just would not like to eat. If the patient is a child, ask the mother what is the easiest or the most difficult thing to feed the child. Okay. Sleep. I've noticed that sleep position is something that we tend to not take very seriously and very, very lightly. Because our patients usually say, I sleep in any position. But sleep position is the position in which you fall asleep or you tend to get sleep in. Okay. You might roll and move in sleep, but the position in which you go to sleep is usually fixed. So make sure you are eliciting this from your patient. Ask the patient what position you get sleep in. Okay. The next thing is complaints during sleep. Now complaints can be sleep, walking, talking, teeth grinding, salivation. So make sure you are eliciting this as well. Dreams. Dreams, get the description as much as possible. Okay. How often was the dream? What much more that the patient can tell you about the dream. Okay. Whether the dream is repetitive or any dream in particular that they remember very well, even if it is an old dream. That helps you to understand the patient a lot better. Thank you. And as we're talking about chronic case taking tips, let's move further. Now, if your patient is a child, please don't forget to ask about birth history. Okay. Don't forget to ask about growth and development. Now, birth history comprises not just of the type of birth, but birth weight as well. Okay. Also, ask about the milestones. Okay. The regular milestones have to be within the normal range. Next, you must not forget if your child is at least till the age of 6 years, you also have to ask about mother's history during pregnancy. Okay. Her mood, her health, lactation history as well. Okay. When we move to adult history, let's talk about next is thermals. Now usually when we talk of thermals, what people do is they talk about tolerance. Okay. Thermals is not just about which weather can you tolerate. Now if you are living in the humid weather or in a city where there is a lot of heat, okay, or where there is a lot of humidity, it's very difficult to tolerate that weather. Okay. What you're supposed to ask is you're supposed to ask about the fan, the AC, covering and bathing in summer, winter. Now what is that? When you talk about fan or AC, ask the speed and temperature and whether do they need it or not in summer, winter. Covering. Covering is any extra covering or full clothes that they wear in summer, winter. And bathing is what kind of water in summer, winter. This is the right way of deciphering the thermals in your patient. Okay. And you must also understand that where the patient has lived for maximum number of years in their life also matters, because the climate there can be very different from where they have moved to now. Okay, so that is something that you must ask. Also talk and ask about any complaints with changes in weather. Please don't forget to ask that. Thank you. The House of Homeo Ed. As we're talking about tips for chronic case taking, let's move on to the most important yet difficult aspect, and that is mentals. Now, mentals doesn't just talk about symptoms. You are supposed to talk about the life depiction and life situation. Okay, you are supposed to get the entire evolution of the person. Okay, like we get evolution of symptoms, we have to get the evolution of the person. The evolution can be understood only if you go back to the childhood. So talk to your patient, converse with your patient, and then start getting to understand how the patient has evolved over time from childhood till adult age. What all situations have come and how has this patient dealt with them and how have these situations molded the person. Okay, that is the right way of eliciting mentals. So with this, I have tried to tell you the most important and the most important yet difficult things that we tend to miss out. So with this, I have tried to concise and tell you what are the things that you must not forget and are very, very important in our chronic case taking. Thank you.